Pat came to us after she had been kicked in the head by a cow on her family dairy farm. Pat had some previous concussions from her hockey career, but this particular concussion left her with a lot of symptoms.
Yeah, I wasn't really functioning at that point. I couldn't really do anything at all. My husband had to cook the meals. He had to get the boys on the bus in the morning. He was doing all of those extra jobs that I used to do. I was feeling a lot of pain behind my eyes. That seemed to be where most of my headaches were concentrated. And I noticed I was really sensitive to light. I couldn't move my eyes and head independently anymore. That was one of the big things that was bugging me. I didn't have my peripheral vision anymore. And it seemed like even the slightest things to do with my vision would set off my symptoms again.
RightEye was really essential in confirming that the diagnosis with the eye movement troubles that Pat was having, because it shows us in such fine detail that we just can't see with the naked eye how she's moving her eyes. And I think, maybe I'm speaking for you, Pat, but I think maybe validating what you were telling us you were experiencing in your everyday life, the symptoms. Yeah, and I think what sometimes happens with concussion patients is they're supposed to get better in a week or two, and then if they don't, sometimes doctors will come at it from a psychological perspective. Well, you should be better by now, and something's going on psychologically that's continuing these symptoms. So for a patient to come in and get that report in their hands where they can see what their eye movement is supposed to look like versus what their eye movement is looking like, it really validates that, oh, something is going on with my eyes and something is leading to my symptoms.
I think at first I was really shocked. I knew that my eyes were bad. I didn't realize how bad they really were. And once I had looked over it a few times and had convinced myself that, yes, that really was how bad they were and how bad my injury was, then when I brought it to my husband and brought it to my doctor and said, this is what the test found, this is how my eyes move or how they aren't moving, this is what it's supposed to look like, everyone just said, wow, no wonder you don't feel good. Let's try and get you better now that we know what we're dealing with.
We can tell if there's something going on, but RightEye just gives so much more information. 1,800 data points in a 15-second blip is just, it's such a wealth of information that you just can't see with your naked eye. And so it's been such an invaluable tool to our practice.
That last retest right before I graduated vision therapy, the change was huge. And I was so excited that day. I went home and I was telling my husband and calling my parents, telling everyone, this is how much my eyes improved. This is how much vision therapy helped me. And I know it helped me. And it wasn't just in my head because I have these pictures. Yeah. This therapy and the tools that the clinic had, including RightEye, were really life-changing. And it was what made me say, yes, this does help, and I would recommend it to anyone.